So really, fusions are most common reason for, flat foot is the most common reason for hindfoot and midfoot fusions. And really, there's multiple options that we have available to us when we're going to go down the fusion route. And just like any deformity we've been talking about, whether it's cavus or flatfoot, there's just not one operation that works for every single patient. So again, multiple names, like we said. I don't know if any of these are 100% accurate in everybody, but people call this acquired flatfoot deformity, peritalar subluxation. Your patients will just come in and say, Doc, my arches are falling. So really what it is dysfunctional posterior tendon, and it's a degenerative condition, and you lose your medial longitudinal arch. And again, it's hard to know whether this happens in a sequential or fashion, or whether this can all happen and the spring ligament can go, which supports it, or if the tendon goes, then the spring ligament gets stretched out, and that really is what supports the talonavicular joint. And so once you lose your spring ligament, you get this peritalar subluxation. You start getting some uncoverage medially there. Also, it goes the talar head goes out plantarly, and you get some increased talar declination. So the hind foot is made up of the three joints: the subtalar, calcaneal, cuboid, and talonavicular, and they all work in coordination with each other. But really, the midfoot plays an important role in flat feet, and so does the ankle itself. So everything in the foot is interconnected, even though we consider this hindfoot joint just a three-joint complex. That's not probably accurate. So when you're looking at the hindfoot anatomy, I think obviously weight-bearing views we need to get of the foot as well as the ankle. And I think that now that weight-bearing CT has come in for the pretty big deformities, before I'm going to do any type of fusion, I will make sure that we get a weight-bearing CT on them.